Welcome to Advancing Healthcare Through Simulation. I'm your host, Lisa George, and today we're joined by Andrew Karesa, founder and CEO of blueBell Village, a community dedicated to redefining dementia and memory care through relationship-focused services and interprofessional collaboration. Andy, thank you so much for joining us on the podcast today. Really appreciate you coming in.
My pleasure. Glad to sit here and chat.
Well, let's start right at the beginning then.
Right.
What was the spark that inspired the creation of blueBell Village, and what drew you into this work?
So I never really wanted to be in health. I never thought I would end up in health. I come from engineering in the energy industry, and even in my MBA, I was kind of voluntold that I was going to be the leader of the public and health sector career track at the U of A for the MBA Association. And I said, no, thank you. I want nothing to do with health. All the while as that was going on, my grandmother's Alzheimer's journey was kind of ramping up, and I was watching how the system was supporting her, how my family was having to navigate to support her. And I really noticed that things weren't as perfect as they should be. The system really exists to have individuals fit within the box. And I was thinking to myself, why can't we make the box fit around the person? And from that, I started watching YouTube one night, and it ended up coming up a video of the Hogevik in the Netherlands, and which is the world's first dementia village. And the idea of the dementia village is that everyone that lives in this community, that's a safe community, it's enclosed, that there's no security issues, but they can move between houses at their free will. They can go to a restaurant, coffee shop, grocery store. They can do whatever they need to do and live a normal life, but in a safe and secure environment. So I said, why can't we do that? And, I was a youngish, spry engineer that will, at that point, would soon have an MBA. I was like, I can do this. Somebody can do this. So I created that with the idea that is what I'm going to build to try and support my grandmother. The name blueBell itself is derived from my grandmother. My grandmother's name was Shirley Bell. Her favorite color was blue, and her favorite thing to do in this world was garden, spend time doing gardening, outdoor activities, picking weeds, all these sort of things. And so I thought the name blueBell would really resonate and ensure that my grandmother has that legacy, because she ultimately is the idea that it was created for her. Initially, my goal was I want to build this thing, again, very aspirational, like I want to do this thing. It can happen really quick. I got humbled over time. But I said I want to build this thing so that my grandmother, as she progresses, can have this facility and this place that she can live in, a home that is safe, secure, and she has the autonomy that she needs. Instead of my family having to constantly come and try and navigate and support and bring the supports that she needs, we can have the supports built around her. And that was the idea for blueBell Village. We've kind of changed as time has gone on, but like many entrepreneurial ventures, we do. But the core ethos hasn't. The idea that we believe that we should be restoring the personhood independence of those living with dementia. Oftentimes, dementia, or as my friend Pete Hill calls it, the D word, it's a stigmatized thing that we don't really talk about. Mm-hmm. And when we do, it is something negative. It's an affliction that this person has. It's a negative connotation. Instead, in reality, it's just something this person's going through, and how do we navigate it? So I wanted to see how can I continue to help us move forward and help Alberta and greater society understand it and mobilize it. So we do various things, but all kind of with that core idea and core ethos.
I love the inspiration behind that. And starting something new in the care world isn't easy. You already alluded to your your initial thought and it changed and evolved from there. What were some of the biggest challenges you faced in those early days, and how did you stay focused on your vision?
Yeah, so early on, like I said, we were trying to build a dementia village. Obviously, that requires a big chunk of land, it requires a big chunk of money, and the idea that doing it on my own wouldn't have worked. So I had a consulting firm before. I had blueBell, and what I learned in that entrepreneurial venture is that the best entrepreneurial ventures, the best companies are not done in isolation. They're done in community with other people and having a great team around you. My consulting company, I made sure to try and do it on my own so I can kind of control the narrative, control how we design the work that we did, all these kind of things. And I wanted to approach this in a radically different way. What I wanted to do was to go and bring the right people around me. So in my MBA, we had an individual, a friend of mine, who we were in the same kind of strategy class, and part of the project was, hey, what is an organization out there that you can give strategic recommendations to change? And we end up doing the Hogovic. Her dad was going through Alzheimer's, so he was kind of going through the same journey that my grandmother was going through. And in it, I was thinking, and we were thinking, let's look at the Hogovic and what strategic things we can do. So then she started coming alongside, and she started kind of supporting me in it as well. And then we had one of our professors who was big in the legal startup community. And we said, hey, can you come alongside and help us? And he was helping us. So we had all these people that were coming alongside and helping us to navigate the problems that we were slowly figuring out as we were in a startup. Not knowing how to go about it was complicated. Thankfully, we had like Doug, who was our very first shareholder other than me, who's still along the journey with us today, navigating it, helping us to navigate all the legal challenges that exist as we've kind of ebbed and flowed, including like patent law. Like I never would have thought I would have to try and figure out patent law, which is a whole separate craziness. But especially when I thought we're going to build this facility, this brick and mortar facility, but we ended up having to figure that out. But from the early days and the idea that we were going to build this dementia village, it was complicated, which is why we ultimately shifted away. Mm-hmm. And I mean, that's still my long-term dream. I still would love to see that here. But institutionally, it's got complicated. We found that the period of saying we want to do this thing and start, meeting people and starting trying to raise funds, all these kind of things, the price jumped multiple factors. We all know what happened with COVID and the economy, right? Everything got really, really expensive. Bureaucratically got complicated. The navigation with the AHS, it got complicated. Then the dismantling of AHS really put that nail in the coffin of we would exist between multiple sectors, and the sectors don't really know how to navigate that sort of facility, which we learned how it would have to operate in BC, but it's complicated. Mm-hmm. So we ultimately went and said we need to do something else. We had this other thing, which is the kind of predecessor of Connect, and we kind of just leaned in on that, and it's been a cool journey from that. But like any entrepreneurial venture, there's been a lot of challenges, but the challenges are what makes you stronger. The challenges are what really helped us really refine what's important to us as an organization and really refine our ethos. It also gave us the opportunity to determine who is in this with us for the long term and who of those people really believe in the mission, because it's not easy. Every day is not fun. I'm not like Mark Zuckerberg, who can go travel around and buy half a Hawaiian island to do whatever I want with. Right? The days are hard. Some days it's a grind. Some days aren't fun. But you know what? We're all in this together, and thankfully I've got a wonderful team that all has the same belief that we can support people with dementia.
It sounds like that early stage really set the foundation for where you're at right now and, hitting your stride, if you will. Can you tell us a little bit more about what you're providing right now and maybe chat more about the Connect platform?
Yeah, so Connect was never something that I really thought we would be operationalizing or commercializing. It was a tool to support caregivers, specifically my grandmother. So like a lot of individuals that are being cared for at home, you bring a lot of people in to care for your loved one. So there's 22,000 people in the Edmonton region with dementia. How many institutionalized beds do you think there are for people with dementia in the Edmonton region?
Ooh, I have no idea.
22,000 people with dementia. How many beds?
10,000?
1,132.
Wow.
So just over 90% of people with dementia in the Edmonton region are cared for at home by their family. Staggering statistic, right? So we can't just keep relying on the system to look after our loved ones. As Dr. Sharon Anderson said on our podcast, you can't build your way out of this problem. You can't build your way out of this mess. And so for us, in my grandmother's case, we had these people coming in because she was being cared for at home by our family, by hired caregivers, whether they're home care companies, companion care companies, it didn't matter. We bring all these people in to really look after my grandmother so she could live at home in her apartment with my grandfather. And
Sounds like that was all very separate, different pieces, and the providers not being connected at all, right?
100%. It goes down to this thing that I've kind of coined the caregiving islands, that all of us exist on our own distinct islands. We all are probably working the best we can, and I can't fault anyone for it. Mm-hmm. But at the same point, what we're doing is not necessarily what's best for the person living with dementia or the person being cared for, because there's lack of communication. It's fragmented. We all don't necessarily understand what we're needing to do. So as I kind of approached my grandmother, I found that the people caring for her, they didn't necessarily understand what my grandmother liked. They didn't understand what my grandmother needed. They didn't understand how her past experiences are leading to some of the behaviors and reactions that they're experiencing. Right. So sometimes things would occur and they would do what they're trained to do, but that would result in specific behaviors that they did not like, that were tougher to deal with.
Or maybe a snowball effect for the next provider that was coming
100%,
in, right?
100%. And so I started thinking, like, why is this the case? Why are we not working cohesively? So I just started building this thing off the side of my desk because I, always need a hobby. So I ended up building this thing that was the predecessor of Connect off the side of my desk that started recording what my grandmother needed, what my grandmother liked, what activities we can do with my grandmother, how those activities will connect to what her mobility concerns are, what her background culturally is, all these pieces. And I started kind of putting this all together as kind of the foundation for what Connect is, to make sure that, whether it's X home care company or Y companion care company, they all can kind of work cohesively. Because to me, I don't care about the bureaucracy and the system of this company is not talking to this company because we're separate and we can't talk to AHS because Connect Care won't connect them all. I don't care about that as a family. It doesn't matter to me. What matters is my grandmother's well-being. That's all I care about. I wanted to do what my grandmother needed because that's how I was raised. And so we built this tool, but then I also started kind of reflecting on the process. And I was like, is this the way it should be? Once we started kind of building past version 0 to something that's a little bit more robust, I started thinking my grandmother who had Alzheimer's, her parents were English, her dad was an MLA in Winnipeg. There's Arthur E. Wright School in Winnipeg that's named after my great-grandfather. Like, that was her lived experience. They were reasonably well-to-do politician kind of family. My other grandmother was born on reserve at Muskeg Lake Cree Nation in just Marsland, Saskatchewan. And so I started thinking, what would her lived experience have been like? The two were radically different. I would ask the care team that we hired, how would you approach this person with this lived experience, with this dynamic, this cultural understanding? How would you approach them? How would they differ? And oftentimes I don't know. I would just do what I could. I'm like, that's not always great, especially for some cultures that have specific norms or concerns. For example, body language or eye contact, or one of these things that if you stare down the person like this, it's going to go badly, right? Right? How do we ensure that the care team is aware of these things? So I started contrasting the experiences of both my grandmothers. And that kind of led into the third piece, that is Connect. So at Connect, we say that we are clinically valid, personally specific, and the third being culturally appropriate. And so really both my grandmothers together kind of formulated that in my mind of how do we approach it. And for Connect, we just said, let's make a tool now and let's build this out so that we can ensure that it is that relevant, appropriate, and contextual tool that individuals need and families need.
That sounds very innovative. I'm sure there aren't many things out there like that so far. How was it received by the providers coming to give that care?
Yeah, it's definitely different. A lot of the care providers, from a software perspective, they're used to some of the conventional software that says, this is what we do. I'm going to record what happened in my day, just for an auditing perspective. But what we're doing is really kind of breaking new ground, really. A lot of the providers really like the idea, right? And I think that for us, what really matters, though, is that the families like it, because that's what I'm about, is making this easier for the family. That's ultimately who it should be about, right? Who is going to look after my grandmother best is going to be the family. They ultimately have the biggest stake in it, right? But I think the providers, the ones I've talked to, the ones that are kind of using it now, they really like it. They appreciate it. They see value in what it's providing. The idea that we can help them kind of merge that conversation, the chasm between organizations, we can have bridges between the islands, really is enticing for them. So it's been really good, well received from organizations, from families, as well as associations as well. We've got really good traction on different larger entities. For example, United States, we're heavily involved. All Home Care Matters, which is the largest home care organization in the Midwest United States.
Wow.
That was through like a podcast conversation that whole thing started. But it's really cool to see how it's expanding.
Yeah, that's fantastic. I feel like it's really opening up those lines of communications, which might happen when it's in, all providers are in the same institute, but obviously we're hearing that's not an option for most of the community that needs these supports.
Yeah, and one interesting thing is that an area of specific interest for me is, how do I help bring this in to navigate the crisis upcoming for Indigenous dementia. So again, like I said, I'm status First Nation. My grandmother was born on Muskeg Lake, and I have a soft spot for how do I support my community. And the Indigenous dementia right now is rife. We're expected terrible projections here. So for context, we're expecting between now and 2050 a 273% increase for Indigenous people living with dementia. There's various compounding factors. I mean, in the year 2006, we had 5% of Indigenous population was over the age of 65. 2016, it was 7%. by 2033, we're expecting it to be 16%. So we're slowly seeing our elders are getting older. But with that, we're also seeing these issues with things like Alzheimer's really ramping up in our First Nation communities. We're seeing lots of problems with access, trust issues institutionally with First Nation individuals and the healthcare system. I want to be the organization that can come into community and say, I'm not going to prescribe this and say you have to use this, but I have resources around that I can offer and support you with. And I've got a lot of really good uptick with a lot of the health leaders and health directors in various nations because of it. Because being a First Nations individual, an primarily Indigenous-owned organization that can come in and support them, I think is a really, really important piece, because as we see the Indigenous population grow, which is an interesting fact that the Indigenous population in Canada is actually the fastest growing demographic out of any other population in Canada.
Wow.
So because of that, I want to be on the leading edge to say, we know that Indigenous population is going to grow across Canada, not just on reservations. Instead, we're going to advance into, urban hubs, and how do we into urban facilities. So how do we ensure that Indigenous individuals in facilities, hospitals, all these kind of things are cared for in the right appropriate way? That's where I want to see Connect being, and because I think that that's so important, and it's based on Indigenous specific epistemology as well, not just saying we're going to put a blanket approach that says you have to have this white Canadian Eurocentric model applied to Indigenous people. Instead, we can have truly Indigenous ideas and philosophy and culture baked into it.
Well, it's definitely needed from the sounds of it. I really appreciate the proactive approach. Often healthcare seems like the system is set up to be reactionary only, and it's great to see companies like your own and individuals like yourself really taking that step forward. So thank you for that. Where do you see blueBell? So you've kind of alluded to where your plans are going here in the next, I'm sure, 5 years or even less, but most of our listeners are really from that innovation, healthcare, education side of things. With what could be a takeaway for them around, what your goal is here with blueBell Village, and maybe about relationship-centered care and services in general?
Yeah, I think that for me, I don't know where we're going to go. I don't know what we necessarily are going to do. Like I said, I never thought I'd be in health. So for me, it's kind of just the idea that we just need to be flexible and adaptable. Like Proverbs 69 says, we can establish our course, but ultimately the Lord will establish our steps. So I just have faith that where I need to go, I will get there. And I think that for other people, it's the idea that we just need to give up control and say, this is where we need to be and how we need to do it to reach the people that we need to. Because I didn't think I'd be doing this. I never wanted a podcast. Now we have the Dementia Collective, and we had some really, really cool folks coming on. And we're still, like I was telling you before, we're booked up for the next 3.5 months for people wanting to appear on and talk. I've actually had a point where I've actually turned people away. That's a whole separate story. But we had a couple interesting requests. But nonetheless, we just want everyone in the space to start working forward towards focusing on what really matters, and then letting the course make its own way. Like a river is going to slowly carve its own path, right? Let your own journey carve its own path instead of forcing it to go down a way, and that it'll still break through.
Mm-hmm. But be willing to take that first step, right?
100%. It's especially in the entrepreneurial world, it's scary. Frankly, it's expensive. Nobody really talks about the fact that becoming an entrepreneur is expensive. It's really expensive. And so just be willing to do it. If you have a vision or a passion, do it. but don't do it in isolation alone. Find the people around you that can come along and support you. I have some folks that they're not officially part of blueBell, but I will call them for questions or get perspectives. So before we do things, they're behind an NDA and everything just so we're protected. But I will call them and say, hey, blank, this is what's going on. What are your thoughts? What are you thinking about this? How would you approach this? And then I get the board as well. We talk through things, but nothing is done in isolation. It's technically my company. I own the majority of it, but I don't want to be the exclusive arbiter of this. Is this what we do? I think that community is so important, and a collaborative decision-making model really ensures that I take any sort of vanity or self-promotion or anything out of the equation, which oftentimes in this space, it kind of happens.
Well, it sounds like the whole idea is based on collaboration. So it's not surprising to hear you say that. It's so wonderful to hear about the great connections that you're making and people coming forward. With that in mind, I'm sure many of our listeners are thinking they know someone that could use this support. How can they go about getting connected through blueBell Connect?
Yeah, so the unfortunate thing is that most people, 1 in 5, have some sort of lived experience with somebody living with dementia. 20%, right? We can throw a rock in this room and hit somebody that has lived experience.
Yep.
Yeah, yeah, exactly. It's so prevalent, so common. They're projecting it's going to end up being 1 in 4 in the next decade and a bit. Wow. So again, not good, but it is what it is. There's research, hopefully, that's going to help, get us past this, but nothing's happening anytime soon, unfortunately. But if folks want to get in touch and get supports, kind of 2 things that they could do. The first and most accessible thing, listen to the podcast. A lot of time, the families will care themselves first. My family did it for a couple of years. Instead of bringing in organizations, maybe you'll have an AHS or formerly AHS home care worker might come in periodically for something, right, but primarily the family will look after them. And they're saying, how do I care? What do I need to do to look after my loved one? And the first thing I'd say is easiest, most accessible way is look up the Dementia Collective on YouTube, Spotify, Apple Podcasts, these kind of things. And we will probably have had people on the podcast that are kind of going through what you've been through, that are your cultural ethnicity, that have different academic or practical experiences. So that's the most easy and accessible way. Then if you kind of get to the point where you're running into some struggles and trying to figure out how do I navigate, how do I move forward, maybe I'm bringing multiple care people in. Maybe it's just I am looking after my loved one for multiple hours a day and we're struggling. What activities can we do? What I'm doing isn't working. I don't understand the nuance of frontotemporal dementia and how that impacts some of the interpersonal connection that we're having. Once you start getting into those kind of things, that's kind of where Connect is really helping families out. And at that point, you can reach out to info@connect or bluebellconnect.ca, or just go to our website. There's a Connect Us or Contact Us page. Reach out on there, and you can reach out and you'll get probably me through it. And then we're glad to help and support. And then I get random questions from folks all over the place for various things on LinkedIn and whatnot. So if there's other question, like I have this problem, I don't know where to go, I can usually have someone in my network that I can connect you with. I had someone reach out to me a couple of weeks back to say that them and their sibling live in Alberta, but their mom is in BC and they don't know what to do next because she needs help, but they live here and they can't support. And they're like, who do I contact? How do I move forward? And I'm glad to pass along names. Again, I can't validate that this is going to necessarily work great with this person, but at least these people I'm passing along are either recommended by the people I trust or they are the people that I trust. So
right. It's a starting point, right?
100%. I know the system is complicated. It really isn't. It's only getting more complicated. Mm-hmm. So how can I do the little things I can to make life easier on families? Because we don't often say it, but being a caregiver sucks. It is not fun. It's exhausting. It's time consuming. It's emotionally draining. It's physically draining. But at the same point, it's also so rewarding in a way, because you get to spend these moments where the person is so vulnerable and needed. So if I can come alongside and support these caregivers the way they need it, when they need it, I consider that a success.
Yeah. Well, Andy, I want to thank you so much for coming on the podcast today, sharing your story, and for the wonderful work that you're doing as a part of blueBell Village. It's fantastic to hear about. Really excited to listen to the next episode of your podcast as well. Really love Sharon Anderson. So thanks again, and can't wait to see what happens next and where you take this.
Appreciate it. My pleasure, and thank you for inviting me.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.